Hi, I'm Mark Davison, pharmaceutical consultant and author of Pharmaceutical Anti-Counterfeiting. My day job is to help corporations to combat the counterfeiting of their products. Now, fake products are a big deal these days in many industries, from food to medicines to spare parts. It's not just t-shirts and designer goods anymore. So I spend my time trying to help those corporations to keep it real. And I'm especially concerned about counterfeit medicines. I've traveled around the world and I've seen an explosion of fake drugs in Africa and in Asia, which is killing people every day. But we in the West are not immune either. You're less likely to be exposed to counterfeit drugs in Europe and North America, but the risk is certainly not zero. So by being on your guard, you can reduce your risk even further. And in this video, I'm going to give you a brief patient's guide to counterfeit medication. If you take long-term medication, and especially if you buy your medicines on the internet, you might want to pay close attention. As with all other threats to our safety, such as workplace hazards, the key behavior you need is vigilance. You may not give your medication a second thought, but by being more observant about what your drugs look like, where they come from, you can help eliminate the most obvious counterfeits at least. Here are some of the things you should think about when buying and consuming your medications. The first thing to ask yourself is, do I need this medication? Many chronic medical conditions are accompanied by internet myths about supposed new treatments and cures. There are anecdotal reports of new uses for old established drugs. Don't be lured by online advertising into putting your faith into these remedies, especially if they're off-label uses, not authorized on the pack. See your physician, take advice. Maybe you have an embarrassing medical problem. Or maybe you think you might have a serious condition but you don't want to consult a doctor about it. Think again before you try self-treatment. The desire to avoid a diagnosis can be a strong motivator for people to seek anonymous sources for their medication. Maybe you're shy, maybe you don't want something on your medical record that may cause a problem in getting insurance or employment. Both of these reasons for seeking medication without a prescription are of course understandable. They're also highly dangerous. Always seek the advice and endorsement of a qualified medical practitioner for any medication you wish to take, and only buy drugs from approved channels. Now, most countries have laws that safeguard you from the inappropriate use of any diagnosis you receive, and believe me, if your doctor is embarrassed, I'd be surprised. They've seen everything. The second thing to do is check if the drug is available in your country. If your national drug regulator hasn't approved the medication you want, and you can't obtain the drug locally, ask yourself why that is. If you live in the United States or Europe, you're in the world's most commercially attractive and profitable medical markets. Legitimate manufacturers want to sell to you locally through your pharmacy. If they aren't there, ask yourself why. Ask yourself if your drug sources and methods of purchase are safe. Some buying behaviors are more risky for patients than others, and buying prescription drugs over the internet is probably the riskiest of all. There are many reputable internet pharmacies, but unfortunately, on a global basis, these are in a very small minority. The genuine sites are crowded out by a large number of bogus sites, which look genuine, but may be based on the other side of the world, not in Canada or maybe the United Kingdom as they might claim. And don't think you're harmlessly cheating the medical system either by buying from the entrepreneurial little guy online. Many of these sites are controlled by organized crime. They mix counterfeiting with various other illegal activities like money laundering, credit card fraud, people trafficking, prostitution and identity theft. So be very, and I stress very, careful buying your prescription drugs online. Setting up a professional looking pharmacy website is quick, it's easy and it's cheap, and it's incredibly profitable. Sites get closed down by the good guys all the time, but there are always far more crooks and charlatans selling medicines online than there are genuine pharmacies, so your odds are not good. Genuine websites should show a physical location and a phone number which you can verify. Make a call to the pharmacist, for example. If you can't do that, it's safer to assume it's not a genuine site. Also check the site's accreditation. In the United States, the National Association of Boards of Pharmacy operates the Verified Internet Pharmacy Practice Site Scheme, or VIPS, which certifies and approves online pharmacies. And similar schemes operate in some European countries too. But beware, counterfeiters will also fake the accreditations of the online sites. So nothing should be taken at face value, everything should be checked out. A bona fide pharmacy site should also ask you for a medical prescription or other documentation before they dispense your medication. If you want medication that normally requires a medical prescription in the jurisdiction in which you live, and the site you've gone to doesn't ask you for that, then you have to ask yourself why. The risk of fake drugs, though, isn't limited to online pharmacies. It's not just an internet phenomenon. Be careful buying drugs abroad, and take care when in unfamiliar surroundings or buying unfamiliar brands. Even when getting medication from a well-known drugstore down the street, a little bit of vigilance won't do you any harm. Once you get your medication, look it over really thoroughly. Even if you've used that pharmacy before many times, take a few seconds to check the pack. What does the packaging look like? Does it look like it's been opened or tampered with? If there's a closure seal, has it been slit? Does it look like there might have been replaced? Maybe there's glue residue or a ripped area on the package. If there's a shrink sleeve around the neck of the bottle, check that it looks like an original and it hasn't been resealed. If it's a liquid product, check the rubber seal for needle holes and look for apparent damage or maybe alteration to the collar or the flip cap on the bottle. Does the package or the bottle look scuffed or dirty, like it's been recycled? Genuine medications from legitimate sources should get to you in pretty good shape. And criminals frequently reuse medical packaging scavenged from waste, or the products may have been stored and transported badly in an illegal supply chain, and that's why it's scuffed and abraded, so be careful. If you've used this drug before, does the product and the packaging look exactly the same as the previous times you had it? Look for small differences, different fonts maybe, changes in text size on the packaging, misspellings, color changes, the logo maybe doesn't look quite right. Many counterfeits are very good copies of the originals, but few of them are absolutely perfect. Take the product to the pharmacist if you're unsure in any way. Another simple thing you can check is the label on straight. Genuine drugs are usually machine labeled by the manufacturer with strict quality controls. If the label is poorly applied or not straight, the product may have been labeled by hand. Now this may be simply explained if the bottle was made up by your pharmacist, but if it should have been labeled by the manufacturer, then if it looks amateurish, then that's a bad sign. Once you've opened the pack, what does the product look like? Does the shape and the size of the pill look right? Manufacturers can't change the appearance of their products without lots of government paperwork, so they do not do that lightly. If your product looks different to last time, there could be an innocent explanation. Maybe your pharmacist substituted with a generic product. Maybe there was a pack change by the manufacturer. However, any unexplained change could also indicate either a quality issue or a counterfeit, so if in doubt, ask your pharmacist or physician for advice. If you have multiple packs in a consignment, do they all look the same? Genuine drugs are manufactured in bulk by automated quality control processes, and they have a consistent appearance. If there's variation between individual pills or capsules, that's a very bad sign. If the pills are cracked or chipped or crumbling, that's also not good. Some counterfeit drugs are made with machinery identical to the original, so are difficult to tell apart, but some fakes are made with different tablet presses, and therefore if they fall to pieces, that's probably an indication that it's a fake. Has the color of the pill changed compared to the last time you had this? Genuine medicines, as I said, are highly controlled. They should look the same every single time. Even small subtle changes from appearance between pills in the same batch can indicate a fake product. If the product is a clear liquid for injection, for example, check for any precipitates, any grittiness in the product. Check for cloudiness or color that shouldn't be there. If it's a white powder, check for grayness or specks. If there's anything that isn't normally there, seek advice. Does the medication feel or smell or taste different? Genuine product, as I said, will be consistent, so changes may indicate a counterfeit, especially if there seems to be a strong masking flavor or tainted flavor present, which wasn't in previous batches. Sometimes an unusual pleasant taste or odor may have a manufacturing explanation. There have been quality issues with some drugs that have been picked up by these very things. or it could be that it's a contaminated counterfeit product. So just be aware. If the product needs to dissolve, does it dissolve the same? Again, there will almost always be differences between a counterfeit and a real product in the way they behave physically. So the fake drug may dissolve badly or not at all when it should be perfectly soluble, or it may leave grit in the bottom of the glass, or it may crumble on the tongue unexpectedly. Again, for injectable drugs, any remaining visible particles after you've reconstituted it to a liquid, that's a bad sign. It should be completely dissolved. So what about when you've taken the drug? Well, any unexpected adverse reactions or side effects should be noted and followed up with your doctor. Many drugs, of course, have well-known side effects, which you probably have seen before if you take that medication on a regular basis. But if you've taken it before without problems, then new symptoms this time may be due to something different in the drug itself. Major events, of course, palpitations, shortness of breath, go straight to the emergency room or to your accident department at the hospital. Maybe these events are explainable by other factors, and usually they probably are, but in some cases fake drugs might be to blame. If you have an event that you think may be related to your drug, keep the packaging as well. Ask your pharmacist and physician. It's really helpful in following up these cases if you have the pack that it came in. And one more thing, if you bought additional vitamins, drugs, over-the-counter supplements over the internet or from anywhere else, tell your doctor about these when you have the side effect or bad reaction. It's difficult for them to untangle what's causing it if you don't own up to what you've been buying. By taking these few precautions and staying alert, you can reduce your risk of becoming a victim. If you want to know the technical story behind fake drugs and how drug companies combat that problem, then by all means look up my book. It's called Pharmaceutical Anti-Counterfeiting on Amazon, and I will pop up there as well. Now, your chances of getting a fake medication are not nil, but as I said, if you're watching this in Europe or North America, the risk is probably low. So, as a well-known crime reporter used to say on UK TV, don't have nightmares, do sleep well. My name's Mark Davison. Thanks for watching.